How are you, Dina? I was just searching it to send it out to you. Good morning. Oh, good afternoon. Let me send it to. I see Sis Francis is on. Woo, what a morning. Welcome, everyone. Welcome. I was looking for the link to send to Dina, and then she found it. So awesome. See you ladies are on here. I'll be bringing you out from backstage soon. Let me just send a quick text to others. May be looking for the link as well, so let me send it out to them. But welcome. It's great to see you all. At least I know I won't be sitting here by myself today. Awesome. To those of you who are joining us, let me actually stop the music. But I believe that is. Okay, welcome on board. Let me see. Oh, what just happened? Okay, here we go. Hello, podcasters. We are using technology. I tell you, this is amazing. Sorry for the distraction. I'm still bringing members of this panel on set. Let me see, 1, 2, 3. Here we go. All right. The time difference is something else. Awesome. All right. So let me do a quick intro, and then I will be bringing you guys out from behind, from backstage. So hello, everyone on YouTube, on LinkedIn, and Facebook. This is Nurses in Charge podcast, and this is Share Your Nurse Story, but this section is amazing. None like others in the past. So now we have about 7 of us should be present today, and you will be amazed as to what our storyline is all about, and the amazing Nurses in Charge members who have demonstrated I would say exponentially, extraordinarily beyond their scope of practices, or no, let me just say their call of duty. So I am so excited, and words cannot express. But if you are brand new to Nurses in Charge, we are a faith-based nursing organization that is globally based. By the grace of God, we have touched 20 countries worldwide, where our members are based and practice, and I would say they call home. So being a faith-based ministry in our organization, we don't take that for granted, because we truly know that as Nurses in Charge is based on our principles are that we are stewards of the healing ministry of Christ. Okay, so with that said, we welcome all nurses, midwives, and we say that, but then we have these I would say advocates of nurses who are not nurses at all. They just come on board, and they have truly helped us to grow, expand over the years. So we call this year the year of the Pioneer Nurse. And the Pioneer Nurse is that nurse that is at every hospital, nursing homes, wherever nurses and midwives work. And it is that professional midwife and or nurse who nurtures other nurses and midwives. That nurse also inspires other nurses, and furthermore, that nurse positively influences their colleagues. So this is the year of the Pioneer Nurse. And looking back into 2024, we were able to truly, I would say, pinpoint several nurses. I believe there were 15 members of Nurses in Charge that have truly demonstrated beyond their call of duty, meaning that they're members, and they just step above and beyond serving the community within Nurses in Charge Global. So we recognize them about that was just, I would say it a few weeks ago. But then we decided bring them on board, bring them on set. Now that we are, I would say, relaunching our podcast this year. This is the very first podcast of the year. So bring them on and showcase them to the world. We are all about celebrating, recognizing nurses and midwives globally. So why not bring these amazing leaders and tell the world about them, allow the world to hear what they do and how they bring so much value to our Nurses in Charge community. So with that said, drum roll, because I am bringing out my panelists, and this is a diverse group, by the way. As I mentioned, we have nurses and we have those who are not nurses, but we're all we're all moving this dial. We are all in this movement together, making sure that nurses are connecting, they're celebrated, and they're empowered. So without further ado, I am bringing out my guests for today's section, and we can all go around and get ourselves introduced to you. So here we are. I am so amazed. And here we go. Awesome, awesome, awesome. I'm working on it. Here we go. Welcome, guys. Welcome. What a pleasure to have you all here today.
Hello, everyone. Nice to be here with you today.
Awesome. And I see people are already joining us on Facebook. Perfect. Feel free for those who are joining on from social media. Make sure just feel free to comment, ask questions, and your questions will be populated so that we can read it. And questions or comments or just words of praise for our amazing leaders here today. So, without further ado, welcome again, and I will start by introducing myself, and then you all can take your turns to introduce yourselves. My name is Dr. Nyepu Kemo Hall, founder of Nurses in Charge, and I am also your facilitator for this discussion. And I'm so pleased to have my members from all over the world. I would say different countries, Europe, Africa, the USA are all present here today. So please introduce yourselves and tell us where you are joining us from and what is your role in NIC.
Good morning from my end. I'm Mrs. Frances Put Nimley. I'm the spiritual advisor for NIC. I'm a founding member of NIC. I have a history in working in healthcare. I'm a mental health clinician. I'm a therapist, and I just love partnering with NIC from the day NIC was founded, and I believe in the vision of NIC, and that's why I'm continuing to follow them and support them. Thank you.
Hello, everyone. I'm Dina Paoloni. I'm a nurse and 22 years. I am the NIC Regional Director Europe. I'm also a career coach, and my vision is really to collaborate with nurses all around the world to improve nursing in general, support each other. So I share this vision with Nurses in Charge, I'm very happy to be part of this amazing community. And it's so, I feel blessed to be able to work with all these extraordinary nurses from all around the world, to learn from them, share my experience, and collaborate and improve nursing together. Thank you very much.
Okay, thank you very much. I am Nurse Ruben Marcos Draghi. I'm infection prevention and control specialist. I'm from Nigeria, so I am member of nurses in charge from Nigeria. So I love NIC because of how they motivate, advocate, and support young nurses and even the old nurses in order to transform and realize their real potential as nurses for the impact they are making in our that's the impact we are making in our society and in the world entirely. So I'm really blessed and happy to be on board, and I'm happy to be on this live today. So good afternoon from Nigeria. Thank you.
Hello, my name is Cecilia C. Kwangmala Flomo. I am a nurse and I currently serve as the registrar for the Liberian Board for Nursing and Midwifery. I am currently joining from Liberia. I'm the current NIC Nurses in Charge Liberia ambassador. I'm very much inspired and always excited to be part of this very unique world body. I'm currently also a senior regulatory specialist because that's what I have done nurses and midwives for the past 16 years. I'm glad to be here.
Awesome, awesome. I think everyone just went through your introduction. For some reason, let me see. Yeah, Nurse Ruben went out. Anyways, so all right, perfect. Here you go. You know we're back. Welcome, welcome again, everyone. Forgive me. There we go. Trying to bring the rest of my panelists on set, and for some reason they go in and out. Here we are. Okay, so there's a feedback as well. Okay, I think we can keep going. All right, perfect. All right, so here we go. Every time I want to get going, um, here you go, back, Nurse Ruben. All right. So we're here today to recognize your leadership over the entire year of 2024. We realize that nurses in charge will not be moving forward without so many leaders that have come along, and they are still, you guys are all still with us. But your effort, right, over the year of 2024, where you were inspiring our community by your postings, by educational materials that you shared with the community, in order that when there were members that needed your help behind the scenes, there you were just stepping forth and making sure that that piece of nurses in charge that says we're here to support you, we're here to advocate for you, that is not just in the words, just not in our bylaws, right? And it's not just in like I said, black and white, not just on paper, but actually in action, where our members can truly say, absolutely, all of these members that that have been awarded Pioneer Nurse, the Pioneer Nurse of the Year 2024, these are leaders that we have seen demonstrate exponentially over and over in our community. These are non-nursing professionals who are within NIC, that whenever we reach out to them, they're always ready to meet our needs, to help us find our way. And so on that note, we made no mistake at all, and we're actually very much pleased that we took that time to recognize you all. It took a whole year, but remember, this is the year of the pioneer nurse, and the pioneer nurses will not reach this milestone without all of your efforts over the past year into this year. So as we commemorate an entire year of the pioneer nurse, we had to reflect on the previous year. How did we get here? And this is why you're here today, for the world to see that Nurses in Charge is making major waves around the world. And as we do so, these are some of the individuals, and this is just part one of two of our members who will be recognized here. Next weekend, we'll be back again with the rest of the team, and to make sure that the world can see you and you can feel appreciated, and we can move forward stronger than we started the year 2024. And this year now, we are in full gear. So I want to take this opportunity to just allow you to just tell us more about, I have a few questions for you. In other words, few questions, and I'll be starting. And the question is for everyone, but just take one question at a time and respond to it. So this first question will go to our non-nursing professionals who are our cheerleaders day in and day out. So the first question, I believe that non-nursing professional right now is Ms. Frances Port Nimlin, and I'm looking forward to others joining us so that they can add value to this question alongside you. So the first question is, as someone who works alongside or advocates for nurses, Mrs. Niemelin, what have you observed? What have you observed about the unique challenges and strengths within the nursing profession?
Thank you so much, Sis Nyapu. Before I go into your question, I just want to say congratulations to all the recipients of the Pioneers Award for 2024. Thank you so much for your service. Thank you, nurses, for all that you do for every one of us. So I'm also the founder and president and CEO of the Virtual Swimming International Missions. Virtual Swimming International Missions is a group that empowered women. And through that initiative, I came in touch with Sis Nyapu. I usually spark in the potential of women to be able to find their purpose. Because many of us, God created us for a purpose, and we will just sit here and live and not fulfill the purpose that God has for us. So God has called me to be able to identify those purposes and empower women to go out in their boldness and in their strength to do the things that they love to do. To answer your question, as an advocate of nurses, there are so many challenges and there are so many strengths within the nursing profession. As a person, like I said, I have a history of healthcare. I'm originally from Liberia. I graduated, got my bachelor's in biology and chemistry. I went to the A.M. Douglas College of Medicine. I stayed there for a semester. My father died. I got, that's my passion now for mental health. I could not continue, so I left. When I moved to the United States, one of the first things that I was a CNA. And I'm also in pride to say, in as much as all of the things that I've done, I love CNA because I had the first hand contact and experience with nurses. So I didn't know and I didn't respect nurses then. But after seeing how passionate nurses are about their patient, that the doctor would say something and the nurses would come back and think about it and sit there with me like, oh, the doctor said I should give the person this. But I realized that I've tried this with another patient and it didn't go this way and it didn't go that way. And that nurse would just sit there and ponder over that and just ponder over that and just ponder over that. And I'm like, this person is a nurse. Why would they go through all of those things? And I have seen nurses that will sit side by side with the patient and pray for that patient and be there. I've seen nurses cry when they try, to help a patient and that patient didn't make it. So there are so many challenges and there are so many strengths within the nursing profession. And I know that nurses don't get credited enough for all of the things that nurses do. So with my experience, I see nurses every time I have so many friends who are nurses. Every time I see them, I say, thank you for your service. And some of them will be like, I'm not in the military. I'm not in this. But most of them were seen during COVID in the United States and other places, how nurses came up and nurses were there. Some nurses even put their life on the line for all of those things. So within the virtual swimming, we have so many nurses. I have a health committee that is headed by Sis Nyepu, that we try to be able to look. There are so many nurses or so many people based on the pressure in the nursing profession that are pivoting from the nursing role and going into real estate, going into some other profession simply because of all of the challenges. So we want to be able to make sure that we identify those things that nurses do and encourage nurses and advocate for them. Reach out to community leaders, reach out to leaders around, and provide. Also, I hold a master's degree in public health. So in terms of education and everything, I like to work with nurses because they understand and they see. And I even at the hospital before, I refused to let a nurse practitioner be my primary care because at that time I didn't understand. But now I love to see the nurse practitioner because the nurse practitioner, she's not rushing. She's not working for 15 minutes to see you like the doctor to leave. That nurse practitioner will sit there and be able to tell you all of the things that you need and even give you handout when you leave from there. So as a person who is a nursing profession, I believe that each and every one of us can be able to highlight all of the contributions that nurses make to make for the betterment of this profession. Thank you.
Awesome. That's amazing. You know, whenever I refer to you as a nursing professional, I always forget that you started as a nurse. And once a nurse, you still have that blood. I don't know what color is nurses' blood. You know, we used to say that the law enforcement, their blood is blue. I don't know if you saw any posting around the world during time when there were promotionals out there for police officer, but they said their blood is blue. So I don't know what color nurses' blood are, but Mrs. Port Nimland, your blood is still nursing, okay? So thank you so much for coming along with us. And indeed, you did inspire me to find my purpose. And that's one reason why I've held I would say your clock over the years and say you're not leaving me anywhere. Everywhere I go with me. So thank you so much. And ladies and gentlemen, before I move on to our nursing professionals, welcome on set, Nurse Otino. Thank you for joining us from KPI. Thank you. So before I move on to our nursing professionals, I just want to say that Mrs. Frances Port Nimland, over the entire year of 2024, every day of the week, those are 366 days, she posted instrumental literature from Rick Warren's devotionals every day of the week. She would post that into our faith outreach community. And if you've never read any of Rick Warren's devotionals, please find out, because they are life changing, and reading those every day is just a guiding light. So thank you so much. And if I've never told you thank you, I want to say to the whole wide world to say thank you so much, because indeed you are um, influential in our community. You are an advisor, and you are not staying quiet. May God bless you for what you've done and what you continue to do for NIC members. Awesome. All right. So now I see that we have all members on set. Perfect. All our nursing professionals. So these, I have the first question going out to you all. Alrighty. Here we go. So you've each made a remarkable impact in different areas of nursing. What inspired your journey into this field of nursing, and how has your unique role shaped the way you are caring for other nurses?
Are you calling our names or we just jump in?
Oh, just anyone who wants to start. Absolutely. If you need me to read a question again, no problem.
So let me jump in
Okay.
and say that my inspiration for the nursing community, the nursing profession, the nursing world all started
Mm.
with that passion and compassion of caring and looking out there and looking after individuals, looking after families. I remember when I was in high school, I always felt so terrible emotionally when colleagues, schoolmates had issues, or when I saw them during the day appearing so quiet. I was always jumping into people's business. At one point in time, we even had a workshop when we were YNCA girls, and mine workshop name came out to be Concerned Cecilia. And up to now,
Oh,
some of my old colleagues still called me Concerned. So it is from that backdrop, I actually scanned my community and saw that nurses, those we called nurses, but then I may not have known how deep it was. But I saw my mother saying, "Go to that nurse to treat you. Carry your sibling to that nurse to treat you." So I saw that nurses were even at the community level. I
mm,
didn't need to go to hospital to see a nurse. And like Mother Francis just said, you will see them just everywhere at all times and willing to send hands out to you. So coming out as a child, I thought that the entire hospital, the only service person you had there was a nurse. So I saw the nursing pathway as a service pathway, as a way of reaching out to others, and not just to others, also as a way of supporting and helping your families and your communities. And this was what actually drew me so deeply in standing out to say, I want to be a nurse
mm,
because I want to care for people. I want to be concerned about people. I hate to see people emotionally stressed, emotionally hurt. And then, of course, that passion, that inspiration, even now I work outside the hospital, you may call it, but has kept me. And let me quickly say it. I have just, while on this call, had to again support somebody who came and said, "Oh, I'm not well. I named this one, I named this one." And my husband came running to me and said, "Okay, start this one and do this one." So that passion about the nursing community being in the reach of everyone at all times actually led my dreams of being a nurse, which I enjoy today so dearly. Over.
wow. Wow. The unique stories of every nurse is amazing. What brings us into the profession? Thank you so much for sharing with us, Madam Ambassador. Thank you. Who wants to go next with that question? And the question says, okay, here we are. What inspired your journey into the field of nursing, and how has your unique role shaped the way you care for other nurses?
May I go for that?
Absolutely.
So I want to share a little bit of my story and agree with Cecilia when she talked about the passion of nurses. So I come from a place and a family who don't value nurses at all. So for me, I didn't have the cultural understanding the importance of nursing. And actually, when I was in secondary school, before my mom died, with my mom decided medical school would be a good path for me. Um, but then my mom died, so a lot of situation happened, and I couldn't pursue medical school. But my grandma, she came to me say, I can help you if you can do nursing school because it's shorter. I can pay for nursing school. So I went to nursing school that I was very unhappy because I was supposed to do something else. But then I start to study nursing and I start to interact with nurses. I actually saw the patient that nurses have, how they really can truly change people's lives because we are the first contact with the patient. Nursing, in fact, is the most trusted profession in the world. And there is a reason for that because we really are the advocate of patients. So patients trust us, give us their life. I think there's nothing more beautiful than that. Maybe be a mom or, it's something so even spiritually can enhance your life if you are a nurse. So I realized the difference between nurses and doctor. I start to appreciate nurses more. So I continued my study, and instead of the plan, my grandma came to me and say, I can't pay nursing school, and then once you graduate, start to work. You can continue with medical school. You can pay yourself. No, I continue to be a nurse because I really love being a nurse, and I didn't care to be a doctor anymore. Not because I want not recognize the doctor. Therefore, of course, they have an important role. Of course, it's just I found for myself that nursing was actually my path. But growing up, because I come from Italy. Now I'm working UK, but in Italy, nurses are not valued at all, and I couldn't never understand first, but also accept these. So I always fight for myself, but for the nurses to be recognized with my skill, with my professionalism, with my act, with my speaking and talking. And then when I moved in UK, where UK value nurses very much, I really continue to advocate even more for nurses because I thought there were opportunity to share nurses' value. I think there were no point where I decided I wanted to advocate for nurses. I think it's just start as a start nursing school, like a seed, and that grow throughout my entire career. I'm nurse in 22 years now in a few days, and yeah, I will continue to advocate nurses. If for me, help other nurses in their nursing journey is just you know go together in a mission, hand really hold hands and go through toward the future together. And I think is everyone benefit from that. I may older the other nurses and I can teach them, but I also can learn from my younger nurses. It's very much reciprocity, or nurses older than me. So if we decide to bring things on the table and we can go together to our future, I think the nursing will be enriched and patient will, of course, benefit from that. So there's no specific time when I decide to advocate for nurses. It's just become natural, I believe. Thank you.
Awesome. Awesome. Thank you so much for sharing with us, Dina. And before I comment much about you, I want to go back to Madam Cecilia, our ambassador to Liberia. As you all know, I recently did a nationwide tour in Liberia where I visited different counties. Liberia has 13 counties, and I was fortunate to tour 7 of those counties where we established chapters of nurses in charge in each of those counties, and Liberia is now launched. And furthermore, Liberia has 7 chapters, and we are nurses and midwives in charge Liberia. But I bring this story up because as I toured Liberia for 30 days straight, I realized that there was this level of um, great honor for this lady, for our ambassador. When they Before I got into Liberia, they knew that I was going there because she spearheaded everything. She made sure that you made sure. Thank you so much, Madam Kwangbara Flomo. You made sure that all of these universities that were in each of these counties, they knew about nurses in charge. You truly set the stage. The Beyond nurses in charge, they respect the way in which you treat your colleagues in Liberia. You know, there are leaders who are not liked, and I know many leaders in this lifetime that are not liked. There are other leaders who are well loved by their community they serve, and you are one of those leaders. People love the way you treat them, the way you talk to them, your inspiration for the field. So when I saw that, I said, "Wow, I'm walking in a big old shoe. This lady really, she's done a phenomenal job in Liberia." And I'm just like, I'm an ant walking in this giant's shoes. So I felt great just hearing people marveled about you. So when we say pioneer nurse, you are. This is the reason why when we looked around, who are those in NIC who are truly uh, um, taking this baton and truly exemplifying this leadership that we want for the world to see us as, in this connection, this networking, this inspiration, right? Information gathering and sharing, and beyond our community where you always pour information into us. I saw an imprint of your legacy in Liberia. So thank you so much. Thank you so much. Yes, thank you. Dina, over the years, I would say almost 2 years you've come in, and I see you have never been quiet. You are one of those who you've taught our community. You recently just did an amazing workshop for our entire community, giving of your expertise to our community in the area of AI, climate change. I was like, climate change, yeah, our God talked about that years ago, and no one believed him. Now we know, climate change can truly impact us professionals who are traveling the world. And Nurse Move, your company, truly says a lot about that. And then learning about AI, how we can create AI as nurses. I'm like, I may have a lot of gray hair, but we're all going into this. So thank you so much for what you continue to do. As our regional director to Europe, you are a robust leader, and thank you for what you continue to do for nurses worldwide. That when they're moving to different countries, they tap into your expertise and say, "Hey, I'm moving to America or to Africa. What should I expect?" And you are that leader that's truly giving us the knowledge and information that we need to use. So, I bragged about you, and I can go on all day long. So, back to Nurse Rubin and Nurse Leonard. Question is, we're having the feedback there. The question is, what journey Sorry for that. What inspired your journey into nursing, and how has this unique role shaped the way you serve other nurses?
Will go.
I think we can all hear you.
Can I continue? Okay, thank you very much. I'm happy to join you in this. And I'm sorry that I'm on duty, so I had some interruptions, but I managed to join. One, I want to talk about what inspired me to join nursing and how it started. Then again, I also want to talk briefly on the people I've inspired and why I started a foundation called Let's Talk Nursing. So my name is Leonard. I'm a Kenyan by birth and by nationality, and I'm a registered nurse. Cecilia, recently I was in Liberia. I do flight nursing. So recently I was in Liberia. I came to pick some patients as a part-time. I joined nursing in 2013. That is March 2013. That is when I started doing my nursing diploma. And I was inspired by a nurse who was coming from our village. So when I used to do some drama, I used to do what is called PET, Participatory Educational Theatre, for a certain organization called Care International. So when I used to do those participatory educational theatre for Care International, we used to talk about much on family planning and etc. So when I used to go and visit my friend in that facility, it's called a dispensary, a nearby dispensary. So he used to give me some tasks, like maybe educate these people about family planning, clean for me this place. So I wanted to know what is his role and how did he become a nurse. So that's where he started mentoring me. Currently, is the county director, medical services, and in where I come from. So he helped me get a chance to join a Kenya Medical Training College. That is when I started doing my nursing. Then I finished my diploma in 2016. After that, I started working immediately. I was lucky that I didn't stomach a lot, so I was lucky to get a job immediately. Then I thought of doing something for the nurses, but I started with Kenya. So I thought that nurses, we always get to be trained, but at work you find that people are forgetting a lot. Not that they don't know, but they forget because they are not practicing it continuously. Like now, you find someone working in a rural facility, he can do some things that the person working at a national facility or national hospitals cannot do. Why? Because they are not exposed. So I decided to come up with a group called Let's Talk Nursing that I started in 2016. By then, we were in a WhatsApp group and we were 100 members, but though currently we have 952 members in that Let's Talk Nursing across the country, and even so many others who are Kenyans but are in the United States and United Kingdom. We still accept them. In Let's Talk Nursing is where we learn. We come up with a topic we want to talk about infection prevention, and we have realized that maybe people are doing it wrongly because they are used to doing it. That is, I know Ruben is nodding the head because he's specialized in IPC, but you will find that people are used to do things the way they do it, so they think that is the standard. But in real sense, that is not the standard. So we wanted to educate people day by day on how to do things in a standard way that if you go to United Kingdom, that is the way it should be done. When you come to Kenya, that is the way it should be done. When you go anywhere, that is the way it should be done. Then again, Let's Talk Nursing Forum is an open forum that is open 24/7. in case you are on a night duty, you have encountered a case that you cannot manage or you don't know how to go about it. If you post that question there, you will find people online responding to it immediately. I know at times managing WhatsApp is always a challenge, but I have managed from 2016 to date without scams going in that forum. And even the members, they know very well that this is a forum, an educative forum for all the members. We have different levels of people in that group, starting from diploma level to PhDs. They are our members, and we have also started what is called mentorship program. In this, if for example you are good in research, now we'll give you a group of people to mentor. So from that, from the nurses who are members, they have always shared the contacts of the other students who are interested in doing nursing. We have always done CMEs in different levels, in different hospitals. We are always being called. We send a team to do a physical CMEs. At times we do online CMEs in social media, in WhatsApp, in whichever. We do them just to update us. Then now in schools, we have started going around in medical schools to also talk about nursing and the importance of nursing. Recently, I was in Nursing Council of Kenya. I was called to be a member, a board member, so that I can also advise, because they have a lot of theory, but they are not at the clinical, so they don't know much about what is happening at the clinical level. So that is why I was also invited at that level to always give my inputs. I can say that through Let's Talk Nursing, we have managed to mentor so many nurses. We have managed to mentor the siblings or the children from other people, maybe mostly members who are nurses who are members. We have also managed to talk to so many schools, medical schools especially. And recently, one of the members suggested that now we need now to start doing it live, so that at least we can also mentor those students who are in high school who want to join nursing, at least so that they have a touch to know what is nursing. Because most people think that nurses are assistants of doctors. Yeah, most people think so. And we always advise them that if you are a nurse, you remain to be a nurse. We can still learn from that diploma level to PhD level. And some people appreciate that. We are always happy to join doctors around when we are also giving our inputs, and they are always very happy. I always tell them that call me Nasotieno and I will be happy, but not Daktari or doctor. Thank you very much.
Okay. I'm gonna unmute for a moment and just commend you for 900 plus nurses moving strong through your leadership. Thank you so much. God is a wonderful God. When he drives us to pick to select people, it amazes us when we get closer to those people and get to realize that God makes no mistakes, right? So thank you so much again. There is someone in this chat that's just been giving me private chat messages about you. This person is Chica. Chica says, congratulations to you all for your efforts and to move the nursing profession forward. I especially congratulate Nurse Ruben. And okay, Nurse Ruben, he is doing wonderful work. Keep it up, Ruben. Thank you. Okay. For a moment, I had to go back there and give this person shout out to you. Thank you so much. And Nurse Leonard, LinkedIn has actually given you a big old, I would say, your trophy, and we were very much excited to have you as member of NIC Talk Nursing. Everything you do, you are hitting the global stage with your impact. And when we speak on legacy, this is what we want to leave behind. That when someone think of your name, something ring a bell to them, and it's something great and positively impacting society that you left behind or that you are leading currently. So thank you so much for what you do, and what you continue to do, and the impact you're having on our colleagues. Ready? Nurse Ruben, our Hassan.
I will be brief because of time. Mine on was a transition from coincidence to inspiration and now image. So it's just like a tripartite. So it's a coincidence for me to find myself in nursing. And when I found myself in nursing, I was inspired to continue nursing. And now when I was inspired to continue nursing, I am now like I have like innate nursing in me. That means nursing is part of me, is part of my blood, and I cannot desist from nursing. So this is how my transition took place. So first of all, I graduated from one polytechnic like that. I studied nutrition and dietetics. I applied for medicine, and my second choice was physiotherapy. So I got physiotherapy, but was not cleared to study physiotherapy, and I was cleared to study human anatomy. So from human anatomy, I spent a year. Just part one, I decided to change course to medicine, back to medicine again. When I met the provost of the College of Medicine, he said, "Ruben, you came late, and medicine has been filled up. So I should go." He said I should go and choose any of the course I want. I started from radiography. The HOD was not around. I went to laboratory science, and the HOD is not around as well. So I have to go back to the provost. I told him, "Daddy, none of these people are around. I made my choice to be either radiography or laboratory science." He said, "Ruben, give me your phone." When he collected my phone, he just started nursing. So this is how I found myself in nursing. Yeah. When I found myself in nursing, because I have never been to hospital, so I don't know much about nurses. So by joining nursing after my year two, we started clinical. So when I saw the care given by nurses to patients, there is empathy. They empathize. They care genuinely. Their touch heals patient. From there, I become more inspired to become nurse because of how I see the relationship that exists between a nurse and a patient, which is a healing relationship, aside from the activities they are doing. So from there, I was inspired as well because I came to realize that nobody recognized the effort of these nurses. Why? Because there is a like misinterpretation. So what I found in Nigeria, a nurse is being addressed as a sister, as in charge, as matron. I said, what is happening? Some nurses answered doctor. So if we are working, they will call us doctor. I said, no, I'm not a doctor, I'm a student nurse. So upon all the effort, when we go out, if I tell them that I'm a nurse, they will be calling us doctors all around. And we spend the whole of the day with the caregivers, with the patient, and we treat them with high expectation, and they like what we do. But that glory is not coming to the nursing because they are what accepting titles that are not their own. So I have to meet my lecturer, one of my lecturers. I said, what is the actual professional title of nurses? Is it sister or matron or doctor? He said the professional title of a nurse is a nurse. So I said, if that is the case, we need to coin what? An article to start creating awareness on how should the nurse be addressed. From there, I started my journey of inspiration as a nurse. So I started writing article about the title nurse and using the title nurse because we need to be recognized. We need to accept that we are nurses. We are very important in the community. And I came to realize that the reason why nurses are not accepted to be called nurses, or they are not even proud to be addressed as nurses, was because of the challenges we are facing in the healthcare industry. From what work burnout and even lack of recognition, the feeling of like a nurse is just an assistant, which reverses the case, I think. So these are all the contributory factors. But with the good awareness I've started creating, I got support from many young nurses and old nurses, and now it's gaining a ground. That is where I came up with an abbreviation of the title NR for nurse. So I started from Nigeria, I go beyond Nigeria, I involve some African countries. So from there, I advanced to Europe. I've spoken with ICN Chief Nursing Officer, though they said I should come back and intensify it in Nigeria, then Africa, then I can come global. And I'm very happy that it's getting more recognition, and we are going to give him the right protection. That's just like the ICN has given the protection to the title nurse. We need to adopt, if the state title, we don't want to be putting it's longer, we want to make it short, and the abbreviation is the shorter form, so that we can write it on our name, and boldly when someone sees it, it will capture his mind that these are the nurses we are talking about. So from in the course of this nursing, I became the national president of the Nigerian University Nursing Student, where I led over 40,000 students. And I was one of the best nursing student leaders in Africa. So based on the assessment, and I will receive award in that regard because of how I advocate for nursing. From there, many people were telling me that they are not even aware that men study nursing, if not because of my advocacy. I have to first of all tell them go and check what is the definition of nursing. When they look at the definition of nursing, they realize that it's not a feminine related profession. It's for all that have compassion and care and even serve humanity. We are humanitarian. So I told them, not even nursing, check the definition of midwifery, and you realize that it's not meant for women only to take the profession. So we need to come as men to study nursing. We need to support nursing. So I have a group, aside from the nursing leadership. Immediately I finished my tenure as the national president and got the best leader in Africa because of my resilience and commitment in changing and reforming nursing in Africa. I was given an award to serve as the contact person of West Africa for the African Novice Nurses and Student Initiative. And I am currently serving 15 countries that's in West Africa. So from that time, I tell myself, we need to intensify the advocacy, and I have to create a group. I founded a group known as African Nursing Activists, where I bring together all the national leaders and others from part of other African countries. So they join. Always we argue, we don't allow you to demean our leaders. We ensure that there is respect, and we ensure that the argument is very constructive. And from there, nurses, young nurses, as young as nurses, just think as young as someone can be. He thinks critically because of the knowledge he's getting from there. The professors are contributing because almost all the professors are on that platform. Most of the PhD holders are on that platform. The registrar of nursing and midwifery council are on that platform. We are almost more than 2,000. So if there is any problem regarding nursing, when we raise it there, it's been solved within 24 hours. So this is an initiative that was meant from someone that is member of NIC. I later on found myself in Nurses in Church. Despite all this effort, there are a lot that I've been facing a lot of challenges. But because of how I see nursing and the inspiration nursing gives me, I found another union, association, organization, Nurses in Church. My first meeting with the leaders of Nurses in Church inspired me the more to continue, because I don't used to, if I should receive the necessary support I'm supposed or I'm expected to receive, I could have been better or even higher than this position, and my voice could have been more stronger than it is now. But with the Nurses in Church, they have made me to realize my potential. They have made me to realize that I can be celebrated with all this my achievement. In my country, where I've brought all these initiatives, nobody has ever celebrated me. Nobody, even the council, they didn't even say, "Oh, Ruben, you have been doing well," because I can beat my chest that I'm one of the most committed and most recognized young nurse in Nigeria. But I've never been awarded for that. I've never been appreciated. I can be appreciated individually, but as organization, no. Because sometimes they see me as challenge. But I always tell them that I'm not a challenge if you really knows my importance there. What we are doing is for the nursing. Do I get paid? Do I have any personal interest in this? They said no. Do anybody recognize or give me work because of this? They said no. So we need to understand that it's for nursing, and we need to stand for nursing. So this is how it continues. And I always tell people with this last statement that even if I'm dying, if you said wrong nursing, there is tendency, almost 90% of me surviving. So this is how I love nursing in my life, and I will keep on serving nursing. So thank you very much. Let me stop here.
Nurse Ruben, you're too much for me. Ladies and gentlemen, I believe that was in the fall of 2024, Nigeria got hit with one of the most catastrophic storm, and it was flooded. Nurse Ruben still found time to be on my podcast. He found somewhere, I don't know if he was under the rocks or he went in a cave. Wherever he went, he was able to capture internet, and he was here. So when you talk about being committed, you don't have to say it. It goes with everything you've done, everything you continue to do. And when you told me you're going for your PhD, I was like, yeah! Like, amazing. Go on, go on, go on, go on. You know, so nurses are making big waves that people don't often talk about the good things. They talk about the bad things, all the negativities, and it's flooding the internet, flooding on the news media. So why don't we just talk about all the amazing things that nurses are doing? Furthermore, what nurses are doing for nurses taking care of nurses. Because at the end of the day, if we don't look out for our tribe, we will become extinct. And who wants that? If nurses are there if we know for sure where nurses are there when a human is born, a nurse is there when human die. What if nurses are no longer around the world? What a devastated day for humanity. So in my heart of hearts, I know that God created nurses and gave us this healing ministry for us to be stewards of it. That means that whatever it takes, we'll take good care of the profession, we'll take the best care of each other. That in my lifetime, I want to see where nurses can literally, as you have said, where Leonard said, just to text another nurse, oh, I have this case. Have you encountered this case before? And they're networking and they're brainstorming and they are being innovative, like Nurse Dina once for AI, nurses creating AI, not just using AI, but creating their own avatar apps and capabilities in AI, nurses creation. Amazing. I'm just surrounded by all these amazing, brilliant people that when I'm around you guys, I feel smarter. So hey, let's thrive together. Beyond 2025, thrive together. And I would like to leave every one of us with what Nurses in Charge stands for. Nurses in Charge Global, nurses and midwives in charge global. We stand for the fact that no matter if you have an organization, no matter you've been in this field forever or you're just coming into the field, we are bridging the gap. We're not competing. Competition should be to elevate us. That's the kind of competition we're going for. Not to say, oh, Nurse Ruby already have an organization, or Nyepu is going to steal my idea. No. You become a partner in NIC where whatever you're doing, we want to be there when you're doing it. We want to send our members to help leverage your efforts. So organizations coming into Nurses in Charge, that's the baton we're passing on to the future nurses, where they sometimes feel like they're in a bubble of their own. Break that bubble and get on board, because you would die off very soon without oxygen if another nurse don't put it on you. Because I've read so many articles from the National Institution of Health, and they have truly set their mark from 2020 to 2030, where they want for nurses to thrive. And we can only thrive if we thrive together. We will become extinct if we don't thrive together. Where we see a nurse doing an astronomical work, and we go on there and we galvanize forces and we elevate their efforts and make it possible, meet their mission achieve the vision of that nurse's mission, right? So that is what Nurses in Charge stands for. That's what we're moving. This is a global movement, and we invite all nurses, young, old, even those who have retired, to come on board. Those who are just thinking about it, they woke up one day and say, I have a premonition, I'm becoming a nurse. Come on board, because this is what we do. We have all of these partners. We have the amazing nursing leaders. We have these amazing non-nursing leaders, doctors. We have journalists. Nukana Kwali should be on this panel. He's not here today. He's a journalist who is crazy about Nurses in Charge. He's crazy about nurses in general. Then we have a photographer who trailed the path with me in Liberia. Young, I believe Joshua is not even in his 30s. He is crazy about nurses. You should see his posting in Nurses in Charge walls. And listen, I can go on the lists here and there. So we're not stopping, we're moving forward. So join us or be left behind. And it'll be sorry if I beg the Lord for you if you get left behind, because there's so much happening globally. A lot of research outcomes are impacting our patients' lives, that Africa should not be behind time. Europe should not be behind time. And our morale should not weigh us down. The Lord said his burden is light, right? And our burdens are heavy, so we bring our burdens to him. And that's that one major aim of nurses in our community, our faith-based community, that is there day in and day out, truly holding the fort for nurses to be elevated. So join us. We have so much going on and coming along, and with these great leaders who are taking care of each other, making sure they're inspiring nurses to move forward, they're sharing knowledge, they're nurturing each other. We want a pioneer nurse at every hospital around the world. That is our goal, right? Our short-term, long-term, I would say everlasting goal is that there should be a pioneer nurse at every hospital, where nurses are being nurtured, inspired, influenced to move forward. This whole thing about burnout, I was burnt out until I found my purpose. How can I help someone else find their purpose? You know, how can we help others who are burnt out come along? Don't die off, don't leave the profession, but thrive together. So, ladies and gentlemen, this is why we're here today having this discussion. We will have more to come, and please bring on great ideas. Also, join, be the facilitator of one of these podcasts, or moving forward. Just say, hey, I have a topic I want to discuss, and on this and that day, hey, we will set up your StreamYard, get your audience here, and move forward. That's how Nurses in Charge roll. We don't compete for negativities, but we compete to charge each other on. So thank you so much. Oh my goodness, you guys made my day. And it's Saturday. We've gone the time is fast spent. We started a little late, but thank you so much for your time. Thank you for those who joined us on social media. I see Nurse Kendria. She is just going all over the place. She's another amazing leader as well, young and vibrant, and she's on fire. And she is just in that chat line. So I just wanted to highlight what all she's posting in there. I know she would love to be out here so she can talk more about what she's posting. And like others who are on LinkedIn, Facebook, or YouTube, if you're watching this after the live show, please do support us by sharing, liking, subscribing, and just letting the world know that we exist. Because this mission, listen, the more of us that galvanize these forces, as we see Nurse Ruben, we see Nurse Dina, we see Nurse Leonard, and we see our ambassador, Mrs. Cecilia Flomo. I can't even catch her. She's in China one day, you know, doing her nursing thing, and she is a true ambassador because she don't sit in one place. She's all over the globe. And then we have our spiritual advisor, Sis Francis. God get all the glory and honor, but had I not known you to find my purpose, I would have been ashes. So I was burnt out, I would have turned to ashes, right? But I thank you so much, woman of God, for being my mentor, my spiritual mentor over these years. And the sky is the limit because I know God has a purpose for all of us and those who are yet to come. Any last words from anyone who wants to say anything that is pressing on your heart before we close this segment?
So I just want to say to NIC authority, leadership board, of course, the most inspirational founder, Title Hill, Title Hall. We are excited, my family and I and my team. I have even put in this link in all of the different charts, including the Global Nurses and Midwife Rotary Club, for which I'm a founder. Our headquarters is way there in Australia. But for this award, the Pioneer Nurse, I am really proud of it. And it comes in the right time because this year makes me exactly 20 years since I got into the profession as a careered woman. And all of these, like I said, I have sat in the seat as a nurse leader, nursing midwifery leader, as a regulator that carries a lot of responsibilities. And that's why nursing is so broad. But everywhere, every aspect, like Ruby and Dionette was saying, you find yourself, and Dinah, you find new opportunities. And I tell you, the young nurses, for every opportunity, there is a challenge. And that's why you always have to know that you will meet it, but your ability to overcome is what matters. So to be at 20 years of being a nurse and getting an award as a pioneer, it comes in the real time, and I do appreciate it so much. It encourages me and it inspires me more to fight for nursing. The seat I sit in is a fighting place because I have to prove with the team a person to run a nursing program. And you have the challenge of everyone saying it has to happen. No, it does not. Nursing is now played. You must put in all of the standards, global, regional, that requires you run your nursing program. Of course, sometimes we also approve and sign licensure. People think that walking into nursing is a play, and I said no, and that is the reform I have been working on, policy-wise, regulatory-wise, technology-wise, system-wise. Sometimes I'm a bad person, sometimes summoned, but I keep creating the awareness that nursing must be taken seriously from the manufacturing, which are the schools and the clinical side, up to the entry into the profession. So I do appreciate this award. Thank you. And we cherish it as a family. Congratulations to my colleagues. Thank you.
Thank you, thank you, thank you, thank you, thank you. OMG. Anyone else? As you can see, I'm posting our and other information.
I just have a little thing to add. I just want to say a big thank you to Nurses in Church. It really gladdens my heart. This is really an inspirational pioneer award. So, and I will never take it for granted. And to our viewers all over the world, be it government, stakeholders, policymakers, and non-nurses participants, please and please, we should take nurses serious because nurses are the backbone of the healthcare. So looking at how we are advancing, the healthcare industry cannot even stand without nurses. And we should give them the necessary support because in Africa, we are still facing the challenge of burnout, shortage of manpower, lack of good welfare, lack of conducive environment. We always improvise. So we need to have a very good and conducive work environment in order to serve our patients. And to Nurse Leonard and Nurse Cecilia, Nurse Dina, and Mommy Francis, I'm really inspired by your words and your statement this evening. So please, we should keep it up. For Nurse Leonard, I see it more as a telenursing what you are doing, and I'm really glad and happy that we met here and we are still inspiring more nurses. And to Nurse Cecilia, keep on inspiring more nurses, and we're still young and coming up to learn more from you and Nurse Dina. So I got inspired by all you do. So Nurse Dina, I'm really happy that we are taking this nurse title globally. So please, we should find a way to create more awareness, make it very global, write a good or little article to share all over, let people understand why we need to be using our title and be recognized as the nurses we are, because we are proud of being nurses. So thank you, and thank you to my mother, my mentor, Dr. Nyepu. I'm really inspired always by your words, and I will always be inspired. Thank you very much, ma.
To God be the glory. We're human serving human. Iron sharpness iron, right? That is exactly what we're doing here.
To God be the glory, and I would like to have something. And I thank you very much for this award, because yes, I'm a career coach for international nurses. I help them succeed abroad, and I do this like a job as well. But I do my community service, like coaching other nurses, young nurses from poor country too. So I write LinkedIn article, I do videos. So there's a lot of content that I share as a community service. Like you can access completely freely, and I do this because I think that the more we open our awareness of our value, the more we are able to advocate for ourselves. As I said before, nurses in charge really in line with my value. And I don't, unfortunately, nurses are under a lot of burden at the moment, and there are burnouts and the staff, a lot of problem, and nurses leave the profession, unfortunately. It is a big part of nurses who feel victims of this situation. I like the vision of nurses in charge because we are in charge. And so I would like to say that I thank you for this award as a pioneer nurse, because I help other nurses in increase their awareness of how valued nurses are. So nurses in charge is really in line with my vision. We are in charge, so we don't need any other that save us. We need supporters, of course, but we need to save ourselves, and we need to understand our value first. So increase our awareness and then collaborate and not compete. I mean, a good competition, as you said, Nurse Nyempu, yes, Dr. Nyempu, but not compete in a way that, for example, when I met Nurse Reuben, I already used the title nurse before my name. I just needed to remove from LinkedIn because I have to do the authentication, and LinkedIn didn't allow me to keep nurse. But yeah, this is very important. We have to recognize our value, and we have to fight for our value together. Together, this is important. So not fight each other, but embrace all the people idea, and fight together for this idea. So I'm with you, Reuben, and we do together. Thank you very much.
Thank you, Nurse Dina. Thank you so much, Nurse Ruben, Nurse Cecilia, Nurse Leonard, Nurse Nyepu, and Nurse Francis. You'll always be a nurse, even though you're serving on as our partner in the mental health field. But thank you so much, you all, for joining us. Let's strive together. Amen. You'll have a wonderful day, and look forward to seeing you here again on some major conversation that will shake social media and truly bring light to what nurses are doing globally. Thank you so much. You have a blessed day.
Thank you, Sis Nyepu. Thank you for having me.
Thank you. Bye, everyone. Awesome.
Thank you.
You are
No,
welcome so much.
yeah, thank you.
I appreciate you.
Thank you.
Awesome.
Thank you.
Okay, ladies and gentlemen, that was We Are Thriving Together as Nurses in Charge. And I want to thank all of my panelists that came along. Some at work, some are just having internet issues, but they stayed with the program. And for those of you joining us on social media, thank you so much for your support. Thank you for sharing, liking, and subscribing to our YouTube channel and making it grow, because while we are sharing and I would say spreading positive vibe around the world and truly lifting this nursing morale that has been stumped upon, that has been um, in a catastrophic state of being before COVID, but after COVID, during and after COVID, we are still healing from some of our traumatic wounds. So as nurses, we will thrive together. No competition in a negative mean, but we will compete to rise together as professionals, nurses and midwives in charge global. Thank you so much, everyone. May God bless you all.